This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. And you know, Thomas, today we've got a very touching story. But before we get there, let me set the stage. The Centers for Disease Control say that 1.5 million Americans have some type of brain injury every year. 230,000 of those people, it's severe enough they have to be hospitalized. And unfortunately, 50,000 people die. This affects all Americans and many young people.
If you think about 1.5 million people, what would that look like? I remember the Simon and Garfunkel concert in Central Park. I think there were 1 million, right? People everywhere. Think about 1.5 million people, what that would look like. It'd be just a sea of humanity. And what you're saying is every year.
Yes, every year. That is tremendous. And some of these are very serious, as we're going to find out from the upcoming story.
Steve, in this segment, we're going to meet the two ladies that are involved in this story, and then next segment tell you about including a free resource for people who have experienced brain trauma. But first, to set the stage, let's meet Patti Foster. Patti had a radio career. She was based in East Texas at the time and was involved in a traffic accident that would not only change her life, literally, but would change the trajectory of her life after she recovered.
With my story, like you said, I was in radio all my life down here in the South, in Texas, Louisiana. We covered the area. And about a year after I'd come back is when I was in the crash. We were in a Tahoe. Your audience can envision this with me. We were in a red Tahoe. There were 4 of us. We all had our seatbelts on, being good law-abiding citizens. I was sitting behind the driver. Steve, we were completely stopped at a busy traffic light intersection there in the Smith County area, Tyler area of East Texas. And for whatever reason, as we were completely stopped, I took off my seatbelt to turn and check on the flowers behind me that I bought for all the ladies in this Bible study. It was our last meeting before taking our summer break. As I turned, bam, that's when the impact happened. A tractor trailer rig pulling a trailer full of cars barreling down the highway, not slowing down as he was coming to the intersection. He plowed into the back of our totally stopped Tahoe. He was going 67 miles per hour. Imagine that tonnage hitting that stopped Tahoe. So where I'm sitting, the way I'm turned, it ejected my body like a missile out of the back opposite side of the Tahoe, through that backside window designed not to be opened. When the right side of my face and head hit that window, then it just shot me out like a missile, and everything that went out, it just started ripping off things from my head, my face, my shoulders, my neck, my whole body. Eyewitnesses said, Patti, when you came out, your body looked like a piece of laundry. You went up into the air, and it's like you floated and were suspended in the air until that very SUV you had been ejected from spun from beneath you, and then down to the ground you went, and your body skidded some 3 stories across the highway into the northern side, beyond the northern side of the intersection, and stopped in a lane of traffic. Steve, I've never met the driver of a vehicle that I'm told pulled up in front of my body so that oncoming traffic would not splatter me. When the EMS, when the first responders arrived, they didn't even see my body in the highway, but eventually they did. And one of the eyewitnesses referred to me as a heap of bones and flesh. And it ended up being one of my radio friends who had worked with me for years. But he said, Patti, I had no idea it was you. And the only way I knew it was you or a female was because of the feminine type of pattern on your capris, on your pants. as people milled around the scene, trying to look or just be nosy. One of them heard a gurgling noise, but at first, EMS arrived, tried to work on my body. Is there any hope? Looked for a pulse. No pulse to be found, so they pulled the white sheet over me, assuming I'm dead. Somewhere around there, like I mentioned, of the people milling around, one of the eyewitnesses heard the gurgling noise coming from beneath the white sheet. So they yelled for the EMS and the workers to know this. Second Life Flight helicopter contacted, landed at the crash scene as the flight medic and flight nurse are attempting to put my body onto the Life Flight helicopter. Then my body shut down into a coma. For 6 weeks, I was a living dead person. It was downtown Dallas, Baylor Scott and White, then Bumpsy, Baylor University Medical Center rehab, where I was when I began to wake from the coma slowly. What an arduous task. It was when Dr. Carlisle was there, well known and much loved, there at Baylor Rehab, downtown Dallas on Gaston. They're the ones who taught me to do what all the other doctors said I would never, ever do. Miracles still happen. So that's why I travel with Dr. Adams, Hope After Brain Injury, to bring hope to survivors, to family members, caregivers, care partners, healthcare workers, friends, to not give up.
Now let's meet Dr. Deana Adams. She's a licensed professional counselor, also is the president and founder of Hope After Brain Injury. We'll talk more about that organization in the next segment and tell you about a free online conference that will be coming up in March. But first, the truly miraculous story, by divine guidance, of how Dr. Deana Adams met Patti Foster.
My background is trauma. I'm a therapist, licensed professional counselor. And back in the day, I was a first responder with Oklahoma City bombing. The reason I'm telling you that is because I was introduced to Patti Foster at that time, who was on the radio. She actually was a radio personality and interviewed me. Fast forward about 10 years later, in that time she had had her accident, but we had reconnected. And Mark Twain said this, and I know you guys are familiar with this quote: there's two most important days of a person's life, the day they're born and the day they figure out why. And I figured out why in March of 2008. And it was at that point that I decided we're going to do something to help traumatic brain injury. And as a believer, I'm thinking we have to have hope. And so I started Hope After Brain Injury then in my mind, but it actually became a 501. And to date, we are the only faith-based nonprofit organization for brain injury in the States. Sadly, in Texas itself, it's 1 in 300 families are affected by traumatic brain injury. So we have a wonderful opportunity to help people and to encourage them along their recovery. And we believe fully that the recovery never stops. It's always there. So that's why we say we have hope after brain injury.
And the website where you can find out more is hopeafterbraininjury.org. We're going to be back right after this quick break to talk more about what they do there with Patti Foster and Dr. Deana Adams next on the Human Side of Healthcare.
This is the Human Side of Healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. Traumatic brain injury. 1.5 million Americans are faced with this every year, and we're talking with an organization based here in Texas called Hope After Brain Injury that becomes a vital part of recovery after a traumatic brain injury. We're talking with Dr. Deana Adams, who is the founder and president, and Patti Foster, vice president, and as you heard in the last segment, inspiration behind this organization. Steve?
So let me ask you, Dr. Adams, and Patti also, what would you say are the 3 or 4 main things that Hope After Brain Injury does for the people they serve?
Very simply, we equip them, educate, and encourage. And we bring survivors, care partners, and healthcare professionals all together on the recovery journey. We do that through creating podcasts. We have a podcast, Hope After Brain Injury. We do monthly support groups that started with 7 people in 2011, and we have 50 plus every month. And we have wonderful survivors, caregivers, care partners, healthcare professionals. They're all invited. And then we do a hope lesson where we bring professionals in, and we do recordings, video recordings. We have a studio in Tyler, and then those are posted on YouTube. Again, everything is free. And we have a 1 minute of hope, which is a little devotional or a word of encouragement for just a minute that Patti voiced. So those are available as well.
You know, I understand there's a conference coming up on March 27th. I think you're working with Baylor Scott and White, and I think you're also working with UT Southwestern. They're partnering with you on this conference. Can you explain to our listeners, one, what this conference is, and how can they find out more about it?
Absolutely. You know, I guess it was 3 years ago that we started partnering with UT Southwestern and Baylor Scott and White, the Institute for Rehabilitation, and then the North Texas TBI systems and model system, rather. And it's been an absolute remarkable connection and collaboration. This year, March 27th, the theme is resilience and purpose after brain injury. And the beautiful thing is it's completely free to anybody that wants to come. And this year, Baylor Scott and White they are hosting it. HopeAfterBrainInjury.org will be the place that they can find out more about it.
Yeah, Steve, I have to just make mention right there in this, and the listeners can so connect with this, especially if they've gone through brain injury of any kind in their families. But resilience and purpose, those are vital after a brain injury, and how much we seek for that, work for that, hope for that, look for that, to give us a reason to keep on keeping on, to find our place in this world after brain injury has brought our life to a stop, a halt, a closing. And also the website that the audience can touch base with is hopeafterbraininjury.org. And they can find out information, touch base with Dr. Adams, and also at my website, pattifoster.com, PATTIFOSTER.com.
That's terrific. What a great mission and great things that you're doing to help people with brain injury. Thanks. You know, Dr. Adams, you are a counselor. You work with individuals that have gone through trauma. They have anxiety as a result of the brain injury. And I understand you're now writing a book that's going to help others know a little more and to better understand how to counsel brain injury survivors and their families. And I know it's especially a big struggle during this pandemic. Can you comment a little bit on some of the things you've learned in this book that you're writing?
Absolutely, and thank you for the question. The book is Christian Counseling for Brain Injury, and there is no gold standard, so to speak, for the counseling of brain injury, but what I've noticed is it's a very rare. Not many people have the skill for it because they're not educated. And you can, as therapists and licensed professional counselors, social workers, we can learn more about how to work with the emotional aspect, the cognitive aspect, and the mental aspect that happens with brain injury. For example, when somebody looks the same but they're not the same, and that ambiguous grief that they go through. So what I'm trying to do is help educate and train other counselors on how to work with anxiety, depression, post-traumatic stress, ambiguous grief, self-esteem, finding purpose again. And I'm doing that through writing, and we're also creating trainings for people, and we've been doing that nationally and internationally, how to work with brain injury, especially depression and anxiety. And you're exactly right. This pandemic has not helped at all. And so one of the things that I believe this with everything in me, Steve, brain injury survivors are this world's secret to success. And the reason for that is they're twice as smart as the rest of us. They learn to live. They had their brain injury, then they had to learn to live again. So they are incredible resources for resilience, for finding purpose, that we as normal people, meaning we don't have a brain injury, would so gain so much wisdom for that. And so I give them an opportunity to share that. And when they lose hope or feel like, what's happening to me, I say, you know what, you borrow mine, because I've got all the hope in the world for you.
And Patti, I understand you have some resources to help people and their families dealing with brain injury. How can people contact you and tell us what resources you have available?
Sure. They can touch base with me at my website, pattifoster.com, PATTIFOSTER.com. And my books are there to look at on the website in paperback. Also, they're available in ebook, so just put in my title and I'll tell you those. Also, an audiobook of my story. The book about my story, Steve, is called Coping with Traumatic Brain Injury, One Woman's Journey from Death to Life. You can put that title in wherever you buy your ebook. Also, the audio I just cut a few years ago. Also, I put together a spiritual journal. Some people call it a devotional. There are lessons, Steve, that I learned through all of this. And for me, God is huge. My faith is massive to me because I tasted death. I learned to live again. There's a passion and urgency of living in me that was never there before the crash. Sure, I was full of life, but when you taste death and you have to learn to live again, no. You don't take life for granted. You've got purpose. Lay hold of every moment. So I put together a book called Hope for the Journey, a 52-week spiritual journal. And so it just takes things I learned. It applies to anyone's life with any adversity. It doesn't have to be brain injury. And it helps to make it become real to you, to learn, to go deeper, to have purpose, resiliency after brain injury. But I would love to talk with anyone or travel and speak or however I can help anyone else. Count me in, thumbs up. Hope After Brain Injury with Deana as well. Oh, and right now, Steve, sorry, I almost forgot. I am working currently on a children's book. There are so many kiddos going through brain injury. But Steve, it's amazing how there are no books out there to help them come along, to help their parents know how to help them, the healthcare, how to help them, the pediatricians. It's called The Adventures of Head Trauma Hero. And it's being put together. I've written my part. My illustrator is doing all of that. My illustrator is over in Melbourne, Australia. So it's all being put together as we speak.
That's amazing. What an incredible story. And Dr. Adams, what would you like to say that we haven't already talked about your services and how our listeners can get more involved?
Well, I appreciate that, Steve. And as you know, you can tell that Patti's the inspiration for Hope After Brain Injury. And I've been so blessed to have her in my life. And the thing is, any survivor, caregiver, healthcare professional, you come along with us and you give us the honor, please, of walking along with a very complicated journey, but one which we find exceptionally rich. We will help you find your purpose, your resilience, and your hope. Our hashtag is Be the Hope, and that's what we hope to do for each and every person that connects with us.
We've been listening to Hope After Brain Injury with Deana Adams, licensed professional counselor, founder and president, and also Patti Foster, who is vice president. You can find them on the web at hopeafterbraininjury.org. So don't forget about that free conference online, March 27th, and information on that is available online as well. Now, when we come back, we're going to have a fascinating conversation about type 1 and type 2 diabetes, the number one health issue in America, next on the Human Side of Healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the human side of healthcare. We're delighted that you're with us today, and we're going to talk about something so important to our listeners. It has to do with type 1 and type 2 diabetes. And we couldn't have a better person and a spokesperson to talk to us than Dr. Gunasekaran, who is the lead physician for outpatient diabetes at Parkland Health and Hospital System. She's also an assistant professor in internal medicine at UT Southwestern Medical Center. Welcome to the show.
Thank you so much. That was a wonderful introduction.
For our listeners out there, can you explain what is the difference between type 1 and type 2 diabetes?
That's actually a great question that I get asked a lot. So type 1 diabetes is when some event has happened and your own body attacks your own pancreas, which is the organ in your body that makes insulin, and it essentially kills it off, and you're no longer able to produce insulin. So for the rest of your life, you have to take insulin. Whereas with type 2 diabetes, it's something that can be developed at any age in life. And it's not a condition where you don't make insulin. It's a condition where you don't make enough insulin. And as time goes on, your body produces less and less insulin. And that's why some people end up going on insulin when they have type 2 diabetes. But you can always try other therapies that aren't insulin as well.
In type 1 diabetes, I've talked to people, I think, that, develop type 1 diabetes as a child. Can you develop type 1 diabetes later in life?
Yes, actually, you can. It used to be thought of as just a disease of childhood, which is why people who sometimes have type 2 diabetes in childhood are thought to have type 1 diabetes. But there is definitely an increase in the development of type 1 diabetes in individuals who are greater than 65 years of age as well. So we say there's sort of like a hump in childhood where there's a lot of children that are diagnosed, and then in older people as well, too. And that does not mean you can't develop type 1 diabetes during adulthood. It just means that it's less likely, but still possible.
To kind of pivot a little bit and focus on type 2 diabetes, is there a cure for type 2 diabetes?
I wish I could say that there was, but we don't have a cure for type 1 or type 2 diabetes. Especially with type 2 diabetes, what we've realized is that there's multiple components that contribute to having type 2 diabetes. Part of it is the fact, like I mentioned, that your pancreas doesn't work as well, and that could be from too much stress. Sometimes we see in bigger obese individuals that the stress of having to deal with that much weight makes it harder for the body to use insulin. There's also a genetic component to it as well. When you hear someone has type 2 diabetes, usually there's a couple of family members who have it as well too. But the interesting thing about type 2 diabetes is even if people in your family have type 2 diabetes, it can be very different how easy or difficult it is to control it. So you may have a grandmother who just takes one pill a day, and then your mom ends up taking insulin shots multiple times a day. Even though it seems like they all have the same kind of diabetes, it's different per individual, which makes it harder to find a cure because we haven't figured out how to treat each one of those pieces of the puzzle.
When we think in terms of type 2 diabetes and we look at the Dallas area, then we look at the state of Texas, and then let's look at the entire United States, how common is type 2 diabetes?
Unfortunately, type 2 diabetes is quite common, and especially in the southern states, and we're in what you would call the obesity belt, where we have more obese individuals, and it all kind of layers together. Texas historically has always had a higher rate of diabetes compared to the rest of the country, and Dallas County in the state of Texas has a better rate of diabetes, but the state as a whole has a much higher rate of diabetes. So definitely an issue that's local to us.
You mentioned obesity, and diabetes is becoming more prevalent. Obviously, we're seeing more of it in children. Can you explain that phenomena?
So, unfortunately, in the past couple of decades, you see that children are bigger than they used to be. And one of the thoughts behind that is that junk food or high calorie, high carbohydrate food is just more affordable. So when you see families of middle class or lower class, to get more value for their money, they end up buying higher carbohydrate foods, higher fat foods, and feeding it to their children because they can't afford healthier foods. And so then you have sort of a ripple effect from that, which is that your children are getting bigger and bigger before they should. And so they start developing conditions like type 2 diabetes or high blood pressure at a much, much younger age than we saw in previous generations. The other thing is access to those foods is so much easier as well, too. You can buy these foods at your local gas station or a convenience store, whereas healthier foods are more expensive and you have to go to another grocery store, which could be 10 to 20 miles from where you live. So it's definitely a question of access as well, too.
Steve, this is really important information about why Dallas-Fort Worth is where it is. Dr. Gunasekaran, could you tell us again where Dallas-Fort Worth is in the state of Texas and why we are in that position?
So it is less prevalent in Dallas than it is in the rest of the state of Texas, but it is more prevalent than certain areas. And I'll probably say it's because of the socioeconomic makeup of Dallas. Dallas is very, very diverse. It has a large volume of people who live here. And it goes back to what I was just saying about childhood obesity is access is a huge issue, both for healthcare and for food and for housing. You meet a lot of people at Parkland who are just day workers. If they don't go to work today, they're not getting paid. And they're thinking about how am I going to get food on the table? So I think that you find a higher level of diabetes and obesity in people who don't have all the resources that they need to stay healthy.
So I know that we hear frequently, if you're obese, try to lose weight, try to exercise, try to eat properly. But can a person who is not obese develop type 2 diabetes?
Yes, they can. It's more common in people who are above the weight that they should be. But remember that there is also that genetic component to diabetes as well, too. So if it tends to run in your family, you always are going to have a higher possibility or probability of getting type 2 diabetes. Now, there are other forms of diabetes that we call secondary diabetes that are secondary to some other medical condition that you have. So that's a small segment of people, but also worth mentioning in people who may be thinner but have another medical condition, which puts a strain on their pancreas or their body's ability to use insulin.
I talked to a friend of mine that had let his weight get out of control, and he readily admitted that. And his primary care physician told him that he was very close to having type 2 diabetes. They kind of called it pre-diabetic. And he lost about 40 pounds. And then immediately the doctor said he had avoided a serious situation. Do you ever see things like that?
Yes, I do. A lot of times it's just people being aware that they're at a higher risk. So being told that you have pre-diabetes, it's kind of like a wake-up call to go, hey, your body can't handle all this stress that you're putting on it. There's a chance for you to get off of this path and move on to a healthier path and avoid a lot of chronic medical conditions. If it's caught early enough, when you have someone like this individual you were talking about, that is not actually an uncommon story. What's more of a common story is I tried and it was difficult, or I couldn't get the weight off, or I need more help, and they don't accomplish that goal, and then they walk through that door of diabetes.
You've done an excellent job talking about heredity and how it impacts type 2 diabetes and obesity. Are there other risk factors also that contribute to type 2 diabetes?
So beyond those, one of the more common ones in women is there are certain women that develop diabetes during pregnancy. We call it gestational diabetes. And what it kind of means is when you're growing another human being, that stress on your body is too much for your pancreas to do. And so that indicates to us that your pancreas in the future may not keep up with your needs as well, too. There are a couple of other medical conditions that are associated with it as well, too. Like I mentioned, the secondary diabetes as well. And then certain ethnic minorities are more likely to develop type 2 diabetes even when they have a normal weight. And that's more of the Native Americans or the Alaskan American groups. Some of the ones that you notice have less resources as well too, but we're more of hunter-gatherers in the past, and so they're used to having that physical ability, but now are not as physical as they used to be, and therefore easily put on just even a little extra weight, tips them right over into diabetes.
You know, when you think in terms of type 2 diabetes, what are some of the real medical common complications that a patient might experience?
So as your time with type 2 diabetes progresses, you always have to worry about complications in the eyes. If you're not getting good eye care or having them monitored, you're always at risk for developing blindness eventually. The other one that most people hear about most commonly is getting kidney damage and ending up on dialysis. So once again, we want to be monitoring frequently. And then the final one we generally think about is nerve damage. So a lot of like numbness and tingling in the hands or feet, the development of ulcers on the feet that weren't noticed because you don't feel as well. And so therefore you don't notice the fact that you may have stubbed your toe or pricked your toe or injured it somehow. And there you go. Now you have this big wound and you end up having to get some sort of amputation. And heart disease is earlier and more aggressive in people with diabetes as well.
You're listening to Dr. Uma Gunasekaran. She's from University of Texas Southwestern Medical Center and Parkland Health and Hospital System, talking about the number one health issue in America, diabetes. We continue the conversation right after this quick break.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back. We are talking about diabetes. It is the biggest health issue in America today. Expected about 35 million people, according to the CDC, have diabetes. That's about 10% of the U.S. population. And about 27 million of those are diagnosed. Another 7 or 8 million of those not diagnosed. And that's the biggest part of the problem. We're talking with Dr. Uma Gunasekaran from Parkland Health and Hospital System.
You know, you mentioned the prevalence of diabetes in the state of Texas and even here in North Texas. So I'm going to ask you a two-part question. If someone is diagnosed with type 2 diabetes, question one, what are medical treatments? And then question two, can our listeners make lifestyle changes to help treat diabetes?
For the first question for type 2 diabetes, there are multiple treatment options, and I'm actually going to pull in your second question first. The first thing we recommend is lifestyle modification. So the first thing we say is learn more about your diet. Learn more about what foods cause your blood sugars to go up so that you can make modifications in your diet to make it a little bit easier for your own body to handle the stress that your pancreas is undergoing right now. That's actually the first therapy we always recommend. In terms of weight loss, we usually suggest working towards a goal of losing at least 5% of your current body weight. And what that really does is that it helps your body use your insulin better that you're already producing. So it doesn't have to be that 40-pound weight loss that you mentioned. Even a small amount of weight loss makes your body be able to do this more. The second thing is exercise. Even if you don't lose weight, your body uses insulin better when you are exercising. Your muscles are able to use it more efficiently. So I always tell my patients, it doesn't matter if you don't lose an ounce of weight, just the physical activity is making it easier to take care of your diabetes. After that, that's when the world kind of opens up in terms of treatment, because you end up needing some sort of medication. That could be pills, that could be insulin injections, and some of the newer medications, there are some injections that are actually not insulin as well too. So a lot of variety out there to choose from.
So what are some of the common complications people have with type 2 diabetes?
So as your time with type 2 diabetes progresses, you always have to worry about complications in the eyes. If you're not getting good eye care or having them monitored, you're always at risk for developing blindness eventually. The other one that most people hear about most commonly is getting kidney damage and ending up on dialysis. So once again, we want to be monitoring frequently. And then the final one we generally think about is nerve damage. So a lot of like numbness and tingling in the hands or feet, the development of ulcers on the feet that weren't noticed because you don't feel as well. And so therefore you don't notice the fact that you may have stubbed your toe or pricked your toe or injured it somehow. And there you go. Now you have this big wound and you end up having to get some sort of amputation. And heart disease is earlier and more aggressive in people with diabetes as well.
We've been dealing with COVID-19 since March, and we've had many people hospitalized. How does diabetes correlate to COVID-19, and does it make it even more serious?
That's actually an excellent question, and something that I've been following very closely since I spend the majority of my time taking care of individuals with diabetes or high blood sugars, both in my clinic as well as at New Parkland Hospital. So the statistics for Dallas County is that diabetes is the number one chronic medical condition found in people who were hospitalized with COVID-19 and who have died with COVID-19. And that's approximately somewhere between 45 and 48% throughout the entire pandemic to this point. There have also been a couple of studies that have come out that have shown that if you have diabetes and you're admitted to the hospital, you have a better chance of dying than people who didn't have diabetes. And more importantly, the higher your blood sugars were before you were admitted, so if you had something called uncontrolled type 2 diabetes, you die more frequently than someone who had better controlled diabetes as well. And then finally, in the hospital, we found that if your blood sugars are high when you come in or stay high during your hospitalization, you also have a higher chance of dying. So I feel very strongly with my patients with diabetes, especially with the COVID pandemic, that we want to take care of our diabetes, try to get our blood sugars under control, and then also do the things that you mentioned, which is try to prevent yourself from contracting COVID as much as you possibly can, because you're at a higher risk for dying than everyone else is, and we don't want to put you in that bucket.
Many of our listeners would probably say, wow, after hearing those statistics, why, when you contract COVID, does diabetes make it so deadly?
Well, there's not a lot of information because, honestly, it hasn't even been a year since we found out about this COVID. But some of the thoughts behind it is that when you have diabetes, it really wears down your organs and your immune system. It's a very trying disease on the body. Even if you don't feel different, on the inside, it's really wearing down your organs. And so you're always at a higher risk for contracting any sort of infection. And since your immune system may not be up to speed, it's harder for it to fight. So even before COVID, one of the things that I always talk to my patients about is making sure that they get the pneumonia vaccine, because people with diabetes are more likely to contract pneumonia and then have a difficult time with it as well too, ending up getting in the hospital. Not everyone has to be in the hospital when they have pneumonia, but people with diabetes tend to need antibiotics through their vein instead of just pills. So it doesn't seem unlikely then to say that COVID is very similar. It's a very aggressive infection and it goes all over your body, and you're already in a sort of slightly weakened state because you have diabetes. And so that's kind of the way I think about it and explain it to people is you're already not at 100% because you have diabetes. So when something big like COVID comes through, you have a better chance of being hit down by it.
What a great answer, and you put it in layman's terms so people can understand. And another nugget of information that you just said, and I'm going to repeat it, if you have diabetes and you're eligible to get the pneumonia shot, please get your pneumonia shot. Great advice. I'm going to pivot just a little bit. Let me ask you, how many people at Parkland would you say have type 2 diabetes?
So at any given time, the new Parkland Hospital has about 250 to 300 people admitted with various medical conditions that have diabetes. And not necessarily for their diabetes, but some condition. The actual Parkland Health and Hospital system, if you include all of the clinics and everything, have approximately 45,000 people with diabetes being treated in those clinics.
Do you have any statistics on how much diabetes might cost per year for an individual that has it?
That's actually a great question. It's something that I get asked a lot, and there's actually not a lot of literature on it because it's really hard to figure out how much people are spending on diabetes. It's kind of easy to say inside the healthcare system how much they are. How much do you spend on medications, copay for office visits, or hospitalizations? But the majority of spending in diabetes actually comes indirectly outside of the healthcare system, where you have loss of work days both because you were admitted to the hospital or because you had some condition where you had to come into the clinic, having to spend differently in terms of purchasing food, where you live, transportation. They estimate it's a couple of $100,000 per person during their lifetime just for their diabetes. And that's not including any other medical conditions that you have, which would only increase that number as well.
You know, Steve, this is amazing. And I always like to look for points of leverage. So I think if somebody came along and said that something that was preventable, type 2 diabetes, might cost me $300,000, I think I'd take a listen.
Yeah. And I mean, that's the cheap version because you had fairly easy to control diabetes. Some estimates go up to even $1 million for a person who has multiple complications as well.
Amazing statistics from Dr. Gunasekaran from Parkland Health and Hospital System. Thank you for joining us with that very relevant topic. Thanks for joining us. We'll see you next week. Have a safe one, and we'll be right back here on 1080 KRLD
and radio.com.